Hemophilia. What is hemophilia? Hemophilia is a rare sex-linked genetic disorder which occurs when your blood doesn't clot properly after a bleed due to a lack of adequate blood clotting proteins, also called clotting factors. A person with hemophilia, called a hemophiliac, will bleed longer as opposed to someone with proper working clot factors due to low levels of clotting factors 8 or clotting factors 9. Paper cuts and such small cuts aren't often seen as much of a problem. However, for someone with a severe clotting deficiency, the serious problem lies within internal bleeding. In hot spots like the joint that sees a lot of external contact, internal bleeding could result in damage of organs, tissues, and could prove to be life-threatening. Hemophilia inheritance. As stated, hemophilia is a sex-linked genetic disorder that is a recessive inheritance. This means that one parent must carry some semblance of the condition before being able to pass on the disorder to their children. With hemophilia, the disorder has an X-linked inheritance pattern, and since males have only one X chromosome inherited from their mother, they are at an increased risk of developing the condition. To break this down, this means that if a mother is a carrier of the condition and a father isn't a hemophiliac, the mother will pass the condition to her son, while her daughter will also become a carrier. For the daughter, this is because since the second X chromosome inherited from her father doesn't have the genetic disorder, it will prevent her from gaining the disease. However, with the son, once the mutated X chromosome is gained from the mother, the Y chromosome inherited from the father cannot carry any gene, thereby providing no protection against the disorder. What are the causes of hemophilia? When a blood vessel is broken, there is a sequence of blood clotting events that ends with the formation of a mesh to prevent the loss of blood and eventually solidifies to form a clot. This blood clotting sequence of events is aided by certain blood particles such as thromboplastin, prothrombin, and fibrinogen. Hemophilia, however, is a mutation or change that occurs when the gene that instructs the clotting factors is either defective or missing entirely. With several types of hemophilia and most forms being inherited, in about one-third of people with hemophilia, the condition is caused by a spontaneous mutation that triggers a change within the gene. Symptoms of hemophilia. Symptoms of hemophilia will vary depending on the severity of the disorder and the levels of the clotting factors. If a person's clotting factor is only mildly reduced, then they might only experience bleeding after surgery or intense trauma. However, for a person with severe hemophilia, they might experience spontaneous bleeding. A few examples of bleeding common with hemophilia are bleeding after vaccination, bleeding in the joint, which can lead to swelling and pain or tightness in the joint, bleeding into the skin, causing bruises and a hematoma, nosebleed without a cause, or bleeding after circumcision, just to name a few. The types and infection rates of hemophilia. There are several types of hemophilia, with two of them being the most common. Hemophilia A, also called classic hemophilia, is caused by the lack or decrease of factor VIII. However, hemophilia B is caused by the lack or decrease of factor IX. Additionally, hemophilia A is 4 times more common than hemophilia B, and more than half of those affected by the genetic disorder have a severe form. According to the CDC, hemophilia occurs in about 1 in 5,000 male births in the US, and based on a recent study, done between 2012 to 2018, about 20,000 to as many as 30,000 men in the US are living with hemophilia. Hemophilia isn't disproportionate to any race or ethnicity, affecting all racial and ethnic groups. Screening test. To properly diagnose hemophilia, a doctor will perform a screening test to determine if the blood clots properly. There are a few tests to be carried out to screen for blood clotting properly, but I will only be looking at two of those. The first test is activated partial thromboplastin time, also called APTT test. During the blood clotting sequence, after a blood vessel is broken, the platelets reach the site. They rupture and release the chemical thromboplastin. For this test, it measures how long it takes the blood to clot and the clotting factors 8, 9, 11, and 12. If the test measures a low blood clotting level of these factors, that means it takes longer than normal for the blood to clot. The results of this test will show a long clotting time for people with hemophilia A or B. The second test is prothrombin time, also called PT test. Now, going back to the blood clotting sequence, after the platelets rupture and thromboplastin is released, it will react to prothrombin, a protein produced by the liver. This test also measures how long it takes for the blood to clot, instead focusing on factors 1, 2, 7, and 10. If the test measures a low blood clotting levels for these factors, that means it takes longer than normal for the blood to therefore clot. Within people of hemophilia A or B, the test results from this test will be normal. Clotting factor test. To fully diagnose the bleeding disorder, a clotting test is necessary as the screening test only shows that there is a problem with which the person's blood clots. The clotting factor test will show the type of hemophilia and the severity of the condition. Knowing these two important information will help determine the best treatment plan to combat the disorder. Diagnosis. For families with no history of hemophilia, a doctor can perform tests. Examples being bleeding that continues after a long time after a circumcision, prolonged bleeding after blood is drawn from the heel stick. To determine if the baby has hemophilia, if the child does show signs of the disorder. For families with a history of hemophilia, in the best cases possible, the doctor will try to perform a test to check for the genetic disorder immediately after birth, as the blood from the umbilical cord, which connects the mother and child before birth, is better for finding low levels of factor 8 than it is for finding low levels of factor 9. This means that if the blood testing does show low levels of factor 9, it doesn't mean that the baby has hemophilia B. And a future test, once the baby is older, could dispute any case of hemophilia B. In most instances, these tests are performed on baby boys, as it is imperative that those with severe hemophilia are tested early on in their life. Those with mild hemophilia are usually diagnosed later on in their life, typically after a serious injury with prolonged bleeding. There are a couple of ways to treat hemophilia, with the main one being replacement therapy. Replacement therapy works in the way that concentration of clotting factors, factor 8 for hemophilia or factor 9 for hemophilia B, are slowly infused into the vein. This infusion will replace the clotting factor that is either missing or low. The clotting factor could be made from either human blood or a synthetic version. The synthetic version reduces the risk of inheriting any disease from the donated human blood. Replacement therapy works in two ways. Preventive therapy is one option. Preventive therapy is when the replacement therapy is taken on a regular basis and can prevent a bleeding episode. The other way replacement therapy can be used is as an on demand therapy. This means that the clotting concentration will be injected into the vein of the person while experiencing a bleeding episode. However, a risk attached to on demand therapy is that the damage might have already been done before the clotting factor is received. Other therapies that could be used include desmopressin. Desmopressin is used in mild cases of hemophilia as the hormone can stimulate your body to produce more clotting factors. Clot preserving medication could also be used to prevent clots from breaking down. And finally, fibrin sealants are used to replicate the fibrin made in the body after an injured blood vessel that forms a mesh around the area of injury. Synthetic fibrin sealant is applied directly to the wound and promotes clotting and healing. This treatment is especially useful for dental injuries. Complications. As with all treatments, there are various complications that can arise from the treatment. An antibody, called inhibitors, develops in about 20 to 30% of people with hemophilia A and in about 2 to 5% of people with hemophilia B. Inhibitors are a serious condition for people who do develop the antibody, as it can destroy the clotting factors being injected, which prevents them from properly working. While there is a chance that the antibody could go away on its own, doctors may try a higher dosage of clotting factor to use different clotting factor sources to combat the inhibitors. Another complication that can arise from the treatment is the transfer of viruses from the blood donated in which the clotting factor was made. However, the chance of this happening is very, very, very slim due to the intense scrutiny given to blood being donated. People living with hemophilia are asked to exercise daily. Building up their muscles while also protecting their joints is imperative. This is why contact sports like American football, soccer, hockey, and such are disbarred, while swimming, biking, walking are encouraged. Avoiding certain pain medication is also advised. Pain medication like ibuprofen and aspirin are asked to be replaced with acetaminophen instead, which is a safer replacement. Blood thinning medication are also to be avoided, and protection is encouraged for any and all sports, despite their relative safeness. Now, while there is currently no cure for hemophilia, continued research has brought us along from the days when this disorder killed people. An example of the work being done to fight hemophilia is gene therapy. Within clinical trials happening for hemophilia gene therapy, patients are injected with a modified virus that doesn't carry any virus at all. The modified virus introduces a copy of the defective or missing gene that instructs the clotting factor and is injected to the patient's liver, as the liver is the site in which clotting factors are often produced. It is, in, it is taken into the liver as the liver also grows along with the person, preventing any further repeat of the treatment. After the treatment, should be able to produce their own clotting factors. The hope with gene therapy for hemophilia is that it will eventually replace the constant treatment of replacement therapy with just one treatment of gene therapy. Today, a lot of people are able to live a fulfilled life while also living with this condition. Currently, we are not at the best place yet, but with continued research, we will be able to prevent any and all further deaths from this condition. Thank you.